Be Me. 27. Gender studies professor specializing in reproductive rights and feminist birth theory. Published researcher on medicalized childbirth and patriarchal control over women's bodies. Run blog about natural birth advocacy and female empowerment through childbirth. Always believed women were inherently superior at handling pain and birth because we evolved for this purpose. Men couldn't possibly handle childbirth pain. They complain about minor injuries while women endure labor for hours without breaking. Post weekly about female strength and male weakness when it comes to physical endurance and pain tolerance. Women are warriors. Men are babies who cry over paper cuts. Biology designed us to be tougher. Feel intellectually superior about female pain tolerance and natural birth capabilities. Tuesday evening, attend medical conference on pain management and gender differences. Expecting to hear validation of female pain superiority and male weakness. Instead, Dr. Rebecca Martinez presents research on pain response differences between men and women that completely contradicts my assumptions. Shows data on pain threshold testing, endurance studies, and recovery rates across various conditions. Numbers don't match feminist narratives about female pain superiority. Feel confused and defensive about research challenging core beliefs. Wednesday, request access to Dr. Martinez's full research dataset. Study methodology and findings in detail despite ideological discomfort. Data shows men typically have higher pain thresholds than women across most pain types. Men recover faster from injuries and surgeries. Male pain tolerance increases under stress, while female tolerance often decreases. Only exception is reproductive-related pain, where women show specialized adaptations, but this doesn't translate to general pain superiority. Thursday, research evolutionary biology of pain differences between sexes. Learn that male and female pain systems evolved for different survival challenges. Men evolved higher baseline pain tolerance for hunting, fighting, and protecting group from threats. Women evolved specialized pain management for childbirth, but maintained higher sensitivity to detect threats to offspring. Both systems adaptive for different purposes, neither universally superior. Friday, examine my own experiences with pain and injury compared to male family members and friends. Honest reflection reveals pattern I previously ignored. Brother who played through sports injuries that would have sidelined me. Father who worked full days with back pain I couldn't tolerate. Male friends who handle dental procedures and medical treatments more calmly than I do. Start questioning assumptions about female pain superiority based on selective observation. Weekend, research pain management in medical settings across genders. Study how men and women respond to various pain interventions and recovery protocols. Find that men typically require less pain medication after surgery and return to normal activities faster. Women report higher pain levels and request more pain relief across most medical procedures. This contradicts feminist narrative about stoic female endurance versus male complaints about minor discomfort. Monday, interview emergency room doctors and nurses about gender differences in pain presentation and tolerance. Medical staff consistently report that men typically handle severe injuries with less dramatic emotional response than women. Men more likely to underreport pain, while women more likely to request additional pain management. These observations come from medical professionals, not gender theorists with ideological motivations. Tuesday, research pain differences in childbirth specifically. Study whether women's specialized reproductive adaptations translate to superior general pain handling. Find that childbirth pain management involves complex hormonal systems, including endorphins, oxytocin, and adrenaline that don't activate for other pain types. Female advantages in labor pain don't indicate general pain superiority, just specialized biological adaptations for reproduction. Wednesday, examine pain expression differences between genders rather than just tolerance. Study how men and women communicate and display pain experiences. Learn that men are socialized to suppress pain expression, while women are encouraged to vocalize discomfort. This creates perception that men handle pain worse when they actually may tolerate it better. Cultural conditioning affects pain behavior more than biological differences in many contexts. Thursday, research extreme pain endurance across different activities and competitions. Study data from military training, athletic performance, and pain tolerance challenges. Find that men consistently outperform women in pain, endurance competitions, extreme sports requiring pain tolerance, and military training involving physical hardship. Elite military units, extreme endurance athletes, and pain competition winners are predominantly male despite equal opportunity participation. Friday, week of research challenging fundamental assumptions about gender and pain. Data consistently shows male advantages in pain tolerance across most contexts. Feel cognitive dissonance between research findings and core feminist beliefs about female strength and male weakness. Weekend, research historical examples of male pain endurance. Study warfare, exploration, manual labor, and survival situations across different cultures. Find extensive documentation of male pain tolerance in extreme circumstances. Soldiers fighting through severe injuries, explorers enduring harsh conditions, workers tolerating dangerous physical demands. These historical patterns suggest consistent male advantages in pain management rather than cultural anomalies. Monday, examine pain differences in dental and medical procedures. Interview healthcare providers about gender patterns in pain response and management. Dentists report that male patients typically require less anesthesia and handle procedures with less anxiety. Surgeons note faster recovery times and lower pain medication usage among male patients. These observations come from practitioners treating thousands of patients, not theoretical gender studies. Tuesday, research pain tolerance in children before extensive social conditioning occurs. Study how boys and girls respond to medical procedures and injuries. Find that even in early childhood, boys typically show higher pain tolerance and faster recovery from injuries than girls. These differences appear before cultural messaging about gender and pain expectations. Suggests biological rather than purely social origins for pain tolerance differences. Wednesday, examine my own birth experience and labor management. Recall requesting epidural early in labor and feeling overwhelmed by contraction pain. Compare to stories from male friends who describe handling severe injuries, surgeries, and medical procedures with minimal pain medication and faster recovery. Honest reflection suggests I may not have handled childbirth better than men would if biologically capable. Thursday, research hypothetical scenarios of male childbirth. Study medical literature on pain tolerance differences and how they might affect labor management. Find speculation that men might handle childbirth with less emotional distress and faster recovery due to higher baseline pain, tolerance, and different stress response patterns. Male pain systems designed for acute physical challenges might adapt well to labor intensity and duration. Friday, 2 weeks into research. Substantial evidence that men have superior pain tolerance across most contexts, including potentially childbirth if biologically possible. Feel uncomfortable acknowledging male advantages that contradict feminist narratives about female strength and endurance. Weekend, research pain differences in transgender individuals taking hormones. Study how testosterone and estrogen affect pain perception and tolerance. Find that trans men on testosterone develop higher pain tolerance while trans women on estrogen become more pain sensitive. Hormonal influences on pain appear significant. This suggests that male pain advantages are partially biological rather than purely cultural conditioning. Monday, examine competitive pain tolerance events and challenges. Study gender participation and performance in activities requiring extreme pain endurance. Find that men dominate pain tolerance competitions, extreme endurance events, and physical challenges requiring sustained discomfort tolerance. Women rarely compete successfully in activities where pain tolerance is primary requirement, rather than specialized skill. Tuesday, research military training and pain tolerance requirements. Study how men and women perform in physically demanding military contexts. Find that men typically complete extreme physical training with less medical intervention and faster recovery from training injuries. Special forces and elite military units remain predominantly male, partly due to physical demands requiring high pain tolerance. Wednesday, interview athletic trainers and sports medicine professionals about gender differences in injury response and pain management. Report that male athletes typically return to activity faster after injuries and require less pain management during recovery. Female athletes more likely to seek medical attention for minor injuries and report higher pain levels during treatment. Thursday, 3 weeks into research. overwhelming evidence that men have superior pain tolerance across most contexts except specialized reproductive adaptations. This suggests that men might handle childbirth better than women if biologically capable, contradicting core feminist beliefs about female superiority. Friday, research pain management in cultures with different gender socialization patterns. Study whether male pain advantages persist across different cultural contexts. Find consistent male pain tolerance advantages across diverse cultures with varying gender roles and socialization practices. Suggests biological, rather than purely cultural origins for gender differences in pain response. Weekend, examine implications for feminist theory about female strength and biological superiority. If men have better pain tolerance, what does this mean for gender equality arguments? Realize that acknowledging male biological advantages doesn't negate female strengths in other areas or justify gender discrimination. Both genders have different biological specializations that don't determine social or political worth. Monday, research pain differences in chronic conditions and long-term illness. Study how men and women cope with sustained pain over time. Find that men typically adapt better to chronic pain conditions and maintain higher functioning despite ongoing discomfort. Women more likely to seek medical intervention and report disability from chronic pain conditions. Tuesday, examine pain expression and social support differences. Study how gender affects pain communication and assistance-seeking behavior. Learn that women receive more social support for pain expression while men are expected to endure silently. This may affect coping strategies, but not underlying tolerance. Male pain tolerance may be higher, partly because they receive less external support and must develop internal coping mechanisms. Wednesday, research pain medications and gender response differences. Study how men and women respond to various pain relief interventions. Find that men typically require higher doses of pain medication, but also achieve better pain relief with appropriate treatment. Women often experience side effects and complications from pain medications that men tolerate more easily. Thursday, month into research. Comprehensive evidence that men would likely handle childbirth better than women if biologically capable. Higher baseline pain tolerance, better stress response under physical pressure, faster recovery from physical trauma, and less emotional distress during painful procedures. Feel obligated to acknowledge research findings despite ideological discomfort. Friday, research evolutionary advantages of different pain systems. Study why male and female pain tolerance evolved differently and what this suggests about capability. Male pain tolerance evolved for acute physical challenges like fighting, hunting, and protection. These systems would adapt well to childbirth intensity. Female pain sensitivity evolved for detecting threats to offspring and seeking protection during vulnerability. Different adaptive purpose. Weekend. Examine birth outcomes in cultures where men participate more directly in birth process. Study midwifery traditions and gender roles in childbirth. Find limited data, but some cultures report that male participation in painful initiation, rituals and birth support suggests high tolerance for reproductive-related pain. Men who assist in births often handle the stress and intensity better than female support people in some traditional cultures. Monday, research modern birth partners and pain response during labor support. Study how male and female birth partners handle witnessing childbirth pain. Find that male partners often remain calmer and more focused during labor crises, while female partners sometimes become emotionally overwhelmed by witnessing pain. This suggests men might maintain better psychological stability during their own hypothetical labor experience. Tuesday, examine my own assumptions about female superiority in childbirth. Realize beliefs were based on ideology rather than evidence. Childbirth is female biological specialization, but this doesn't mean women handle pain better overall or that men couldn't potentially manage labor well. Female reproductive adaptations are impressive, but don't indicate general pain superiority. Wednesday, interview pain researchers about hypothetical male childbirth scenarios. Ask about likely outcomes based on known gender differences in pain response. Researchers suggest men might experience less emotional distress during labor, require less pain medication, and recover faster postpartum based on typical pain tolerance patterns. However, they lack specialized hormonal adaptations that help women manage reproductive pain specifically. Thursday, 6 weeks into research. Ready to acknowledge uncomfortable conclusion about male pain tolerance and hypothetical childbirth capability. Evidence strongly suggests that men would handle childbirth better than women in many respects, if biologically capable of pregnancy and labor. This doesn't diminish female strength, but does challenge assumptions about gender and pain superiority. Friday, write research paper on findings. Title: Pain Tolerance and Gender. Challenging assumptions about childbirth capability. Argue that male pain tolerance advantages would likely translate to better childbirth management if biological reproduction were possible for men. Weekend. Prepare to publish findings despite knowing they contradict feminist narratives about female pain superiority and male weakness. Data consistently shows male advantages in pain tolerance that would benefit hypothetical childbirth experience. Acknowledging this doesn't support gender discrimination, but does require honest assessment of biological differences. Monday, present findings to Gender Studies Department. Reception is predictably hostile and defensive. Colleagues argue that research undermines feminist empowerment and shouldn't be published regardless of empirical validity. Feel frustrated by ideological response to scientific evidence, but understand threat to established beliefs. Tuesday, submit paper to medical journals focused on pain research rather than gender studies publications. Receive interest from pain. Researchers who appreciate empirical approach to gender differences without ideological constraints. Wednesday, continue research on pain differences while defending academic freedom to study controversial topics. Believe that honest examination of gender differences serves equality better than maintaining false narratives about superiority. Thursday, 6 months after beginning research. Fundamental shift in understanding of gender differences and biological capabilities. Men would likely handle childbirth better than women if biologically capable based on superior pain tolerance and stress response. This doesn't diminish female reproductive achievements, but does challenge assumptions about gender-based capabilities. Friday, final reflection on research journey and implications for feminist theory. Started believing women were inherently superior at handling pain and childbirth. Discovered that men have biological advantages that would benefit hypothetical birth experience. Acknowledging male strengths doesn't threaten female equality, but does require more nuanced understanding of gender differences. Maybe true feminism includes honest assessment of both male and female capabilities, rather than maintaining ideological narratives about superiority. Maybe biological differences don't determine social worth, but do affect specific capabilities in measurable ways. Maybe acknowledging everyone's strengths and weaknesses creates better foundation for equality than pretending differences don't exist.